Preventing disease is the cornerstone of any healthcare system, regardless of whether you are a human, dog or cat. So what then is the difference between holistic vet care versus traditional vet care? There seems to be a distinction made by alternative veterinary practitioners that they provide holistic vet care and conventional or traditional veterinarians simply treat the disease symptoms. Is the story though in fact a little more complicated than that? Hi, I'm Dr. Alex from ourpetshealth.com, helping you and your pet to live a healthier, happier life. And welcome to the second video in my Evidence Matters series, where I discuss how to know what to believe and why things might not be as they first seem. So let's start with the term, but for clarity, I would classify myself as a conventional veterinarian, and I'll discuss what this means later on in the video. So what does holistic mean when it comes to vet care? Well, holistic veterinary medicine is characterized by the treatment of the whole individual, including their environment, diet, and lifestyle, rather than just considering the symptoms of the disease. Unfortunately, the term holistic has been hijacked and the meaning has shifted for many people. The result being that holistic vet care is commonly believed to be something that is only practiced by alternative or complementary practitioners. In other words, the use of therapies such as homeopathy, acupuncture, chiropractic, and the recommendation of raw feeding has become synonymous with holistic care. As a result, those who recommend these alternative approaches in many, but not all cases, claim that veterinarians who do not subscribe to their beliefs are simply treating the symptoms of a disease and not addressing the underlying root cause and practicing a holistic approach. I would assert that this is absolute rubbish. All veterinarians advocate that their overweight patients should lose weight rather than keep quiet and simply prescribe insulin when or if they become diabetic. Everyone would discuss reducing stress and increasing water consumption in a cat that had a history of cystitis or bladder obstruction. Any vet treating a patient with arthritis would advise weight loss, supplementation, exercise and environmental management as appropriate rather than simply hand over a pot of painkillers. To do otherwise would be to do a disservice to our patients. It would be far more lucrative to do away with vaccination and instead treat the parvovirus pandemic that will undoubtedly occur in a very short time frame. But no, instead vaccinations are recommended to prevent deadly disease developing. And this is something that I discuss further in the video on vaccination and teeter testing that I'll just put a link up here. So all of these steps are aimed at addressing the underlying cause of a patient's problem, taking in a patient's environment, their diet and lifestyle. And isn't that what the definition of holistic entails? Let me suggest an alternative view of holistic vet care versus traditional vet care. The difference between self-appointed holistic and conventional practitioners is often the fact that the former, so the holistic, put greater weight on their individual experience or beliefs rather than the weight of scientific evidence. And this is even if their conclusions are in direct opposition to the bulk of the evidence currently available to us. In other words, they endorse alternative medical interventions that time and again have failed to demonstrate a reliable, repeatable and significant positive patient result. In fact, these interventions are embraced as addressing the perceived root cause of whatever health problem is felt to be present. With some alternative practices, the jury is still out in that there is little evidence to support or to refute the claims that are being made. In other cases though, the evidence is overwhelming. Just take a look at my video discussing if homeopathy works in pets, let alone in people, that I'll link up here and again down in the description. Now, of course, we don't know everything, and to claim that conventional vet care has all of the answers certainly would be foolish and naive. In many cases, there are big gaps or grey areas in our knowledge of certain conditions. Unfortunately, though, many of these gaps and grey areas are instead painted as clear, simple, irrefutable black and white facts in many of the online alternative sites and forums out on the internet. Certainly in some cases, time may prove that various alternative practitioner beliefs are right. Certain nutraceuticals or dietary supplements may collect enough evidence to show that yes, they do provide a significant overall benefit to our patients with certain conditions. It might be that certain feeding practices are shown to be the right option for certain individuals or even species as a whole, but the evidence is just not there yet, and certainly not to any great strength that some might have you believe. As a vet though, I also strongly believe that my clients deserve to know when my management or treatment preference is based on opinion rather than evidence, or if the jury is still out. Wouldn't you want to know the same? Wouldn't you also want to know when the weight of evidence actually suggests that a specific treatment or intervention has been studied extensively and even then failed to reliably show it does any individual any good? If we all ignored scientific evidence, we would still be using leeches and bleeding to treat all kinds of ailments. After all, many practitioners of the time strongly believed that these treatments worked, and many would have had stories of their patients improving after such interventions. Now, all of this is not to say that conventional veterinarians have nothing to learn from alternative practitioners. Their consultation approach generally takes much more time, and it can go into details of the patient history that can be very difficult to obtain in a 10 to 15 minute consultation slot. In most cases, 15 minutes is more than sufficient to gather all of the initial information needed to start an investigation or to start treating a problem. Clearly though, some cases would benefit from a longer initial evaluation. More time would also allow a more thorough discussion and explanation to be given. Again, in short consultations, this can be very challenging to deliver successfully, and that's one reason why I started Our Pet's Health. Preventing disease through increasing awareness and putting various different strategies in place is my #1 aim. And it is because of this some of the first content that I produced on ourpetshealth.com and here on YouTube included series on preventing obesity and successfully dieting your dog and cat, along with the recognition and successful treatment of arthritis and the environmental strategies that we can put in place to really reduce our reliance on drugs. And there have been many more articles and videos focusing entirely on prevention. I am a conventional or a traditional vet, and I make no apologies for that, and I'm not unique in my belief that prevention is better than cure and that the underlying cause of a problem should be addressed wherever possible. In fact, I'm distinctly average in this view. I do though demand that wherever possible vet care should be based on the evidence available wherever possible and not just personal belief or conjecture. Quite simply, evidence matters. Join me next time where I continue my Evidence Matters series and discuss something known as the Dunning-Kruger effect. Now, this is something that everyone who frequents pet forums must absolutely be aware of. So, until then, I'm Dr. Alex from Our Pet's Health, because they're family.